very much, Wes. On the last point, I think confession is due. Having been in Boston for 37 years, as thrilled as I am about the Rangers' victory that led them to be in the World Series, anybody but the Yankees would have been. Well, I am delighted to welcome all of you to UT Southwestern today, to family and friends of our first-year medical students on this very special occasion in which these students will receive one of the universal symbols of the medical profession, the white coat. And of course, we'll be hearing much about that later in the afternoon. From the perspective of someone who finished medical school a little more than 30 years ago, I think I can say with some authority that this is a truly exciting time to be entering the medical profession. We're living in a period of truly world-changing discovery that's transforming our understanding of illness and transforming our ability to address the unmet needs of our patients. At the same time, we should acknowledge that society is demanding ever more of us as physicians and our teammates in providing health care, as issues of the cost of medical care, quality and access are understandably and perhaps inevitably at the forefront of national discussion. So it is both an exciting and a challenging time for these students to be entering the medical profession. But one thing that is enduring and underlies this path that they are undertaking, and that is the unequal privilege that each of them will have to be trusted and allowed to be part of their patients' lives. And as they navigate the challenges of medical school itself and look into the future of their careers in providing that care, I hope each of you will never lose sight of that driving mission and that privilege which brought you to medical school here at Southwestern. So we're delighted to have all of the members of the first-year class with us at UT Southwestern, and today, for you, the family and friends of these students, to have a chance to see the wonderful campus around us and to understand this great journey that they begin. Now, I have the pleasant duty this afternoon to provide an introduction to the many people in this auditorium who are here for the first time. In the 2 years since I arrived at UT Southwestern, the pleasure of describing the accomplishments of all of those who have been part of this campus since it was begun nearly 70 years ago never gets tired. I'm delighted to have the opportunity to do that again today. Indeed, UT Southwestern had humble beginnings. In 1943, a group of civic leaders looking around with ambitions for Dallas to be truly a leading urban center in this country felt that that would not be possible without a first-rate medical school. And they founded the Southwestern Medical College as a private institution in the only facilities that they could find that were available, and those were, in fact, already past their best years. They were barracks left over from the First World War. Now, in the nearly 7 decades since that time, tremendous things have been accomplished, and much of it further catalyzed when UT Southwestern, several years after that initial founding, was incorporated as a component of the UT system, and with it, the beneficiary of state support, in addition to the continuing support of the community that was responsible for its founding. And you see here a recent aerial view of this campus. It actually requires such a lens that it's hard to appreciate the true scale and scope of what is now the UT Southwestern Medical Center. But for point of orientation, we are here on the South Campus, right in the Gooch Auditorium. And at this site, all around the medical school proper, you see the development of the Parkland Hospital, and just behind it, the Children's Medical Center, two key partners, and which will be part of the experience of every medical student in this class. And then in the foreground, the more recently developed North Campus, and across from it, the West Campus with a university hospital and outpatient facilities, and in this area here, continued expansion of the university with the development of a biocenter for technology transfer, and ultimately the location of a new Parkland Hospital, which I'll come back to in just a moment. So let me tell you just very briefly, in a very capsulized way, about the activities which go on this campus. It is the convergence of three missions which are core to an academic medical center: research, education, and clinical care. And if you leave with no other message, I would want you to really appreciate the way in which all three of those missions converge to enhance each other. The research is better for the presence of challenging students and trainees. The clinical care is better because around that clinical care, trainees are asking their faculty advisors, well, why do we do that? And those questions of why translate into new questions that can be addressed through research. And so the distinct mission of an academic center is by the integration rather than the separation of these three missions. Now, having said that, let me tell you a bit about each of them. Indeed, we are incredibly fortunate at UT Southwestern to have a talented faculty, really unsurpassed wherever you might visit in this country. As highlighted by the many members of our faculty who have been elected to the National Academy of Sciences, which colloquially I've heard referred to as the Hall of Fame, to stay with our baseball analogy. And also the Institute of Medicine and the Howard Hughes Medical Institute. A roster of this sort would be the envy of any medical school, and truly is a reflection of the quality of the faculty that the students here will have the opportunity to work with and learn from over the course of their years at UT Southwestern. And perhaps no way more more crystallized than to see this picture of four of the faculty members who are recipients of the Nobel Prize, a picture which frankly would not be found at any other medical school in this country, because this is unique in the concentration of such distinguished and accomplished faculty. Our faculty are working across many areas of unmet medical need. On this slide, I list but some of them. Most importantly, these are the problems which are really the biggest challenges for our society today: to understand the basic underlying causes of diabetes, obesity, which is proving to be a problem of epidemic proportions and increasing. The causes of cardiovascular disease, of cancer. Our scientists are working to understand the causes, but moving beyond that to translate those into new insights that can be the foundation for better treatment. Wes has mentioned in a very brief way some of the various domains of our educational and training mission. It is truly one of a remarkable scale. As you've heard, we have three schools here on campus: the medical school with, in total, approximately 900 students, and a graduate school which offers advanced degrees, doctoral degrees in the full spectrum of the basic sciences and applied sciences, which inform our understanding of health and disease and which drive discovery, ultimately to lead to better health care. And our third school is a school of health professions, which confers degrees in programs that address many of the other dimensions of care for the team, the other members of the care team with whom our students will be working as physicians, including physician assistants, clinical nutritionists, physical therapists, and others. And collectively, this campus is dedicated to fulfilling what are gaping needs for well-trained caregivers in a